So today we're going to be talking about postural syndrome, or bad posture, as it's more commonly referred to. It's become a problem in our society nowadays that hasn't been a problem so much in the past many decades ago. Because of the industrialization of society, there has been an increase in desk jobs. And with that increase in desk jobs comes a sitting down for long periods of time. And sitting in that position often leads to kind of this flexed over position, typing at computers and whatnot, and various other types of jobs that lead to bad postures. This bad posture is damaging to your spine. And so, one of the things that we're going to focus on today is how we can combat that. I'm going to take you through a series of treatments that you might see in a chiropractic office, including adjustments, myofascial release or massage work, and therapeutic exercises, all that we can use in the combat of postural support and postural awareness.
Here in our office, we always begin with a thorough history to determine the cause of injury, as well as what sort of functional activities the patient is performing in their daily lives that may contribute towards the condition. Following our history, the doctor will take the patient through a detailed orthopedic examination. This will include taking active ranges of motion to determine how muscular tension, joint locking, or joint complex injury is contributing towards the condition. Ranges of motion are often measured for accuracy. Next, the patient is taken through a series of orthopedic tests to determine the source of the condition. The patient also receives a postural or possibly even a gait analysis to note any areas of compensation and imbalance. Should the patient report any signs of nervous system compromise, a complete neurologic examination would also be performed. Standard procedure in our office is to have a radiographic evaluation or x-rays. This allows the doctor to visualize spinal curvatures and joint surfaces, as well as to rule out more serious pathologies. After the doctor has had the opportunity to study in detail the examination results and x-ray findings, a comprehensive report of the doctor's findings is presented. In the report of findings, the doctor will explain how the patient's history correlates to the evidence from orthopedic tests and x-ray findings. The doctor also explains how the problem will be corrected with patient-specific treatment plans. The treatment plan will lay out all of the doctor's recommendations, prescribed therapies, and supports, as well as any financial obligations beyond insurance coverage. And on to treatment. Here we see a sample of manual chiropractic adjustments. Lower force techniques are also available. Adjustments are useful for correcting spinal misalignment and poor curvature. It also helps to reduce adhesions, fibrosis, and scar tissue. Chiropractic adjustments have an incredible amount of clinical research to prove their effectiveness and safety. Here we use rapid release technology to reduce muscular tension in order to provide better postural support. In the next clip, you will see a sample of therapeutic stretches meant to reduce spinal stress and to increase posture.
Hi Nina, so we're going to go over some stretches. First one that we're going to go over is the upper trapezius stretch. The upper trapezius is a muscle that focuses in this area. It's a common contributor into postural problems and can cause a lot of pain. So what we're going to do to start out with is I'm going to have you take your head and look down towards your armpit, and with this hand you're going to reach over your head, grab the back, and pull it down. You should feel the muscle stretching right through this area. Okay? And then the next one that we're going to do is a levator scapulae stretch. Levator scapulae is a common muscle that causes problems with that little knot that you often get right there in the shoulder region. So what you do for that is I'm going to have you bend your head straight to the side, no turning your head. And you're going to reach right over and grab the side of your head and pull it to the side. Okay? Alright, so I want you to be doing those stretches on both sides equally. We want you to be balanced out.
Perfect.
Good?
Thank you.
You're welcome. So today we've taken you through kind of what a chiropractic treatment might look like for somebody who's looking to increase their posture and add postural support and awareness. We took you through chiropractic adjustments. Chiropractic adjustments can be done in many different ways. There are lots of techniques that are available to us out there. It doesn't always have to be the manual therapy with our hands. It can also be a lighter technique. We've also taken you through myofascial release, or the rapid release that we like to use here. There are other forms of massage work that we have available as well as a broad team of massage therapists. We also took you through a exercise that will help to increase that postural awareness. So now you have kind of a little bit of knowledge in building what we can do in supporting ourselves to increase that posture and have better spinal support.
Thanks for watching our video today, guys. We hope that you liked it. Don't forget to subscribe. Also, come check us out on our other social media sites.